this lecture, we're going to try to figure out how this local bodybuilder, Mike, is able to compete even at the age of 57 and looking great like that. Well, to understand how he does it, let's look at muscle tissue in a microscopic view. There's the sarcomere, that's the contractile unit of each muscle fiber. If we look closely, we'll see the key players here, actin and myosin. There's the thick myofilaments. So here's a muscle contraction. You see, muscle doesn't stretch. Muscle just slides. Now look at this. There's the actin. There's the myosin head. Here comes calcium. We need calcium for muscle contractions. Calcium is going to bind to troponin. And now troponin, watch it. It's going to slide to the side. So tropomyosin can slide. There's the slide. And now the binding sites are open for the myosin head. There it is. Now this can only happen if there's calcium and if there is energy in the form of ATP. There it is. Bam. See, a lot of bodybuilders, they're sucking on protein during their workouts. They don't realize there's no protein involved in this contraction. Calcium, energy from ATP. There it is. Okay, let's talk about muscle tone here. If we look at the neuromuscular junction, that's the synapse between the neuron and the muscle. Acetylcholine, it's held in these little synaptic vessels here. Look to the lower right. There's acetylcholine. It's just a neurotransmitter that travels across the cleft and stimulates muscle contraction. Even when muscles are at rest, there are some neural impulses, so we keep that muscle tone. Without that tone, then we wouldn't have our posture. We'd just slump to the ground. And we have this action going on in smooth muscles, the digestive system, which are contracting sometimes hours at a time. Hypotonia, that's when we lose muscle tone. And in this case, the electrical impulses are absent. And we don't like to see this. Can be serious, caused by an imbalance of electrolytes. That's someone who's often severely dehydrated. Disuse, someone who's bedridden at a hospital, or if there's a nervous system disorder. But we also have flaccid paralysis. Look to the far right. I know it's kind of a funky image, but we use botulism toxin from botulinum. Do we have the scientific name here? We don't. Okay. Clostridium botulinum, that toxin causes flaccid paralysis. And so you just relax that tissue. But if you get too much of it, you relax to death. So these injections are very controlled. I talked about hypotonia, which is not much muscle tone. How about hypertonia? Well, it sounds like a good thing, but generally it's not. Because if we have spasticity, then the impulses are just too intense, they're prolonged, and so the muscles and tendons tend to stay overly flexed. And so if you look to the far right, you'll see the effects of hypertonia. Often it is arms, legs. Rigidity, here's Clostridium tetani. That's a relative of botulinum. In this case, it causes body-wide muscle contractions. And the muscles of the back are more powerful than the abdomen, so this arching is typical of, this is a soldier in Napoleon's army. The early symptoms are stiffness of the face and jaw muscles. It used to be called lockjaw for that reason. And that's why we don't feed infants honey, because there's botulism spores often in that. But by the time we're adults, we have a fair amount of immunity to small amounts. Isometric, you've probably heard of isometric. That's like when you're pushing against the wall and the wall's not going to move. They're important for posture and stabilizing joints, but they don't change the length of the muscle fibers. So you cannot fully work a muscle with isometrics. People used to think you could do that. You just push against something. But you had to have full range of that muscle. Isotonic is more typical what we think of working a muscle. We can have these concentric contractions if you look to the far right. And that is where we're shortening the muscle an upward stroke. I'm sorry, right here. And then eccentric, which puts a lot of stress. Because see what happens in eccentric, if you look to the bottom middle, there's that diagram we started with. There's the myosin head, and there's the actin. And so if you remember, calcium is going to cause that cross bridge. And now that myosin has to hold tight to the actin filament on the eccentric. And that's what's strange. A lot of people who work out in gyms, you'll hear the weights banging, flop. And what they don't realize is the eccentric is where you get a lot of, you get a lot of load and a lot of tearing of muscle fibers and potential for growth. So when you hear those weights slamming, it's usually an amateur doesn't understand. So you have to be patient with those guys. Okay, types of skeletal muscles. Sometimes you hear fast twitch or slow twitch, but what does it really mean? Well, it often means the amount of myoglobin. There's a word. Now see, myo means muscle, and globin we think of blood. So if we have slow oxidative fibers, sometimes called slow twitch, they have lots of myoglobin. They're kind of reddish in color, and they're slow at converting ATP into energy. But okay, that sounds like a bad thing, but they resist fatigue. So these are the marathoners. Okay, they do require a steady flow of oxygen. We call that aerobic. Now a fast oxidative, they are like the slow, except they can function in anaerobic conditions. So that means, like say you're in oxygen debt. You're running fast, and you hit the wall. It's called, and now your tissues don't have enough oxygen, but you can keep running. That's fast oxidative or fog. And finally, the weightlifter's muscles, fast glycolytic fibers. These are called white muscles. They have large amounts of glycogen. See that word down there, glycogen? That is a compact form of sugars. And getting back to that first picture we saw of Mike, the bodybuilder, see a lot of athletes, they're drinking lots of sports drinks. But someone like Mike, he understands that his tissues are loaded with a compressed form of sugar, and so he just needs to drink water during his workouts. So at age 57, his kidneys are still functioning marvelously, when a lot of the guys he worked out when he was in his 20s have kidney disease because they're drinking so much protein and they're consuming large amounts of sugar during the workouts that it's totally unnecessary. Rigor mortis. Okay, get to this diagram. To understand rigor mortis, you have to understand here is the cross bridge between actin and myosin. There's a myosin head. If you remember, calcium binds to here. The only way we're going to loosen that hold is with ATP, which is energy. Remember, ATP comes from the breakdown of glucose. So if you have brown rice or almonds or whatever, that eventually gets broken to ATP, and that's going to help with the muscle contraction. No protein, no amino acids needed right here. That's a myth of a lot of athletes. They think somehow protein is involved with this. It's not. Okay, moving on to rigor mortis. Okay, what happens though is when there's no ATP being released, we just get this cross bridge and no hope of breaking it. Usually about 3 to 4 hours after death, and it lasts 24 hours at least, depending on the temperature, where the body is. And then eventually, as the enzymes are going to digest this cross bridge, and we get those muscles relaxing. Muscular dystrophy. It's really a group of degenerative diseases. Generally, what happens is this dystrophin is not being produced because there's a dysfunctional gene, often a mutation. And so the muscle is going to tear because the sarcolemma, if you remember, here's the sarcolemma. Take a look mid-lower. That's the tough membrane that surrounds the muscle fibers. And if that is not stout, then it's going to tear, and then eventually these muscles are going to die. DMD, that's Duchenne's. That's what the D stands for. It's more common in males because we only have one X, women have two, so they have a backup. So DMD is rare in women, although they get it. Anabolic steroids or roids or juice, they basically simulate testosterone, and they can bind to receptors. So take a look at the middle diagram. There's a steroid hormone. It's going to bind to it's a testosterone or steroid site, and it's going to stimulate a genetic change. Okay, so we're getting into the nucleus, and then we get a new protein. All right, it works really well, but the problem is the body detects there's an external source of testosterone, and so it's going to cut back on its own natural production, and that's why sometimes the testes start to shrink when this happens. Okay, so a lot of the people on the juice, they have to increase their intake of this steroid. Now, remember, a lot of these substances that go through the digestive tract are going to be dismantled, and the body doesn't like to take orders. Right? People can take steroidal pills, but the body is going to decide what to do with that. It's going to break that steroid pill down and use it for making maybe lactase for breaking down milk, or an enzyme for something else. We don't tell our body what to do. So a lot of pills, a lot of athletes are just throwing their money away on these steroidal pills. If it's a patch or an injection, yeah, okay, that has hope of working. Okay, there are androgenic effects of steroids. So shrinking of testicles, I mentioned, hair growth on the body, but loss of hair on the scalp, aggressiveness, and anabolic, we know about that, muscle, bone, and red blood cells. EMG, that's where we measure the electrical impulses. And what we do this for, take a look at the far right. We're using an oscilloscope, and we're trying to determine if the muscle's not functioning properly, is the problem in the muscle itself, or is it in the muscle, in the neural, which I don't have a picture of, neuromuscular junction? In other words, is it a nervous disorder, or is it a muscular disorder? So that's what EMG helps us with. Fibromyalgia, fibromyalgia is really a symptom of many disorders, because we don't really have a disease, fibromyalgia, because we don't always know the cause. For one person, it could be rheumatoid arthritis or osteoarthritis. It could be some sort of deep tumor. We don't know what's going on, so we have this generalized term, fibromyalgia. Tenosynovitis, most of us will experience that. It's just an inflammation of the tendons. Or look to the far right, often a tendon sheath. We have these sheaths that lubricate the tendon as it slides along, and sometimes it becomes inflamed through repetitive actions, although trauma can cause it too. And then we have TFCC, triangular fibrocartilage complex. You can see I usually don't say the full words, I just call it TFCC. If we look at the far right, you'll see kind of a triangular collection of ligaments, and that's near the ends of the radius and the ulna, and it's going to also involve the lunate, which, this is not a good example of a lunate shape, the lunate and the triquetrum of the wrist. And these bones together help with a lot of the movement of the joint. So when these become inflamed, we have pain with movement. Strains, well, there's different types, and this is just when there's, it's different than a sprain, right? Sprain involves ligaments. Strains involve muscle tissue. So you can see the grades of mild, where there's just some localized pain, but no loss of strength. Moderate, where there's numerous muscle fibers, and there's some limited strength as well. And then we have a severe tear, which we hope not to see. That's when there's and usually, this image is not correct. Usually the tear is at the musculotendinous junction, so it's where the muscle attaches to the tendon here. This is pretty rare. Now I'm going to show you one of my favorite races. Justin Gatlin, he injured his adductor longus. He's US. And just take a look, because you'll see that Usain Bolt is famous. Everyone, or no, I shouldn't say everyone, but he's world famous, the fastest man on earth. But what I want you to see is what Justin Gatlin did after coming back from a groin injury. Okay, here's Usain in the middle. And look at Justin Gatlin. Oh my gosh, so close. But of course, there's our hero. He's the name that everyone learns. But to me, Justin Gatlin, comeback king from that adductor longus injury. There he is. There's Justin. Good sport. Going to come over and congratulate Hussein.